Hi, and welcome to Healthcare IT Today. I'm Colin Hung, and today I'm joined by the team at PHSA here in Canada, who's going to talk to us about a very, very interesting innovation that they've come up with called a health visit patient benefits dashboard. And there are four wonderful ladies who are joining me today. I'm going to ask each of them to introduce themselves, starting with Chris.
Good morning. My name is Chris Olson. I'm the Communications Officer for the Office of Virtual Health and Trauma Services BC at PHSA.
Julie.
Hi, I'm Julie Wei, Senior Leader at the Office of Virtual Health, PHSA.
Ying.
Hi everyone, my name is Ying Zhang. I'm also a Senior Leader with PHSA Office of Virtual Health.
And Alex.
Hi, my name is Alex. I work as Communications Coordinator for the Office of Virtual Health and for BC Trauma Services.
Well, welcome. Thank you so much for joining me today on the program. I really appreciate the time you're taking to talk to me about this wonderful innovation that you have done and are going to be presenting at the upcoming eHealth conference coming up soon. But before we get started, maybe if I can ask one of you to just give our audience the quick 1-2 minute overview of what PHSA does and who you are and where you're located.
So, Provincial Health Services Authority, also known as PHSA, is like the overarching health authority for programs and health programs in BC. So there are regional health authorities for the different major regions of the province, and PHSA basically is the overviewing health authority for programs such as BC Cancer, BC Renal, BC Children's Hospital, BC Women's Hospital, that type of thing. So we're not actually a health authority for one particular region. We support the major programs. We are
Wonderful.
based, the corporate office is based in Vancouver as well.
Thank you. One of my favorite cities in Canada, one of the most beautiful cities in Canada. But thank you for that overview. I really appreciate that. So why I became so intrigued was basically this title of the presentation that you're giving at eHealth, talking about this virtual health visit patient benefit dashboard. Maybe can one of you describe what that is?
Yeah, for sure. Maybe I can take this one. I'd like to start with a little bit of like background and context. I can start with what our office does. Like our office is called the Office of Virtual Health. And what we do essentially is we support the clinical programs under PHSA and beyond to better integrate virtual health technologies in their day-to-day workflow. So we can have a better way to provide services to patients and family members. So that's what's going on. And before the year and the global events of 2020, our office has been really busy doing like demonstration projects. So we can say that is like experiment on a controlled scale to try a new virtual health technology and how they can be integrated into care model. So what I did is I had the pleasure to work with multiple, I would say it's like close to 15 clinical programs to trial virtual visits in their service area. So it covers a variety of services from like mental health counseling to pre and post surgical assessment and to follow-up appointments for a variety of needs. And we were able to gather data throughout this demonstration project. And we had one hypothesis that's like virtual virtual visit can save patients time and money because they no longer need to travel to the clinical site to have the appointment. This is almost a no-brainer, but we do not want to take this assumption and treat that as if it's the truth. We want to kind of validate this hypothesis and to know if that does like deliver any tangible patient benefits. If so, how many? We want to quantify that. So that's like the idea behind how we start to like mobilize resource and put together a virtual visit patient benefit dashboard is a part of evaluation for this demonstration project.
And so this dashboard, was it an electronic dashboard that was done, like what was it built in or what was it developed in?
Yeah, it's a Power BI dashboard, and it lives in our internal like reporting environment. And Julie can talk a bit more about the technical side, but that's what I can say.
Okay.
Yeah, we worked quite closely with our decision support team. So there are PHSA centralized reporting and analytics team who helped us calculate it. And yeah, this dashboard is basically a visualization of the calculations and with maps and things like that, so that it is easily consumed by everyone and easily understood.
Actually, that's going to be my next question is how was this dashboard after you created it? How is it used? Who looks at it, and what's sort of the context of how it's used internally at PHSA?
Yeah, I think I can take this one. I can quickly tell you what's included in the dashboard and then talk about how we use it. So it's a very simple one-page dashboard. It's interactive. We basically feed our visit data into it and did 5 things with it. It displays the high-level, like some high-level stats, such as like number of patients, number of providers, and number of completed visits included in the data sets. And then based on that, we did some calculations, such as what's the max distance that traveled if people have to come for in-person visit, what's the max time saved based on that, and what's the total hours saved, and what's the average hour and distance saved, something like that. And then the fun part is we create an interactive map that actually that actually maps out the impact by patient's postcode prefix. So you get to see lots of bubble. The size of bubble pretty much indicates the volume, the size of visits in that region. And you can see where those bubbles are located across the whole province and even beyond in some cases. So you really get to see that impact in a very visual way. That's way interesting than looking at the super long list with thousands of thousands of lines. So we get to see that. And it also comes with the table that compares like number of visits and number of patients in each region. The term they use is PHSA. I believe that means forward sortation area. That's a terminology we wouldn't really understand, but we are lucky because we work with our corporate partners and we were able to use those terms and to help to bring the visualization to life. And to your question is how we use it. Right now, this is mainly used internal within the project team. We use the dashboard in 2 ways. Number one is, of course, as an analytical tool. We use it to see the impact and we play with the information. We also build in some filter so we can slice and dice information from different angle and to try to come up with some general observation, even generate some insights and finding. So we can slice and dice by what program area it is the distance over or under 100 kilometers, or patient's age and gender, those kind of basic demographic features. We use this as an analytical tool. And in this particular project, we use this as one of the input to do our cost benefit analysis, because we did put in like our resource and efforts to enable services like that. And we want to know, does that really benefit patient? And if so, is that sustainable in terms of the efforts we put in to sustain and enable service like this? So that's one use. The second use is actually we use this as a motivational tool. Like we show our stakeholder, like, see, this is a tangible impact because you participate in this project and we did this. So you saved your patient this amount of money, this amount of hours. So yeah, it helps people to feel like super real and feel like really engaged and connected with the ultimate goal and purpose of the project. Yeah, so that's in a nutshell how we're using the dashboard.
And Ying, do you, or anyone else, I mean, do you feel that you mentioned that this dashboard was very motivating, like you could see the impact and the savings of time and cost for the patients coming in because you had adopted this telehealth and video visit, kind of virtual visit capability. Do you think that this dashboard helped convince some people who maybe were on the fence about this, or was it really more just reaffirming what everyone really already knew and believed in their heart about the use of that technology.
From my perspective, I would say this dashboard serves a bit more as the validation tool because we share that with people who are already part of the project, already trying it. It's really good to see like, okay, we put in this much effort and we deliver some benefits to people. I think you asked a really great question. Maybe in the future, this can be used as a preservation tool to help people to change their perception around virtual visit in the long term as well.
Yeah, and also I wanted to add that the challenge with virtual health is that it's hard to demonstrate any immediate health outcome impact on patients. So this is one of the other ways to see an immediate impact on patients. So we feel that this is very valuable.
No, that's a great point, because you know, the outcomes will take weeks, months in order to gather. And even then, there's so many other variables on whether or not the outcome is positive or negative for a patient. But here, the travel time, the costs to even do that travel, it is a direct relation to the adoption of that technology. So I could certainly see that if I was on the fence about something like this, seeing this kind of impact would make me feel good about the technology. What has the reaction been to this dashboard from the people that you've shown it to? Have people been, you know, have they been surprised? Have they been kind of like, wow, this is really cool? Have you got your people's gears turning that this is going to turn into some other dashboards and other things that they want to apply this to?
That's a great question. I would say people really welcome the idea of doing such a dashboard, and people love to see impact in such a direct way. We haven't really shared this on a very extensive basis, so it's mostly within the project team and within our group. And people who has the opportunity to view it really like it. And for people like Julie and myself who are very analytical, we start to actually play with the data and to generate some insights. And we find it to be quite useful and insightful in that sense.
Yeah, and I think I would certainly like to apply this methodology and maybe making it more accurate as well, and use it as a key indicator for any of the other virtual health tools that we're going to be piloting and trialing in the future. So
yeah, another thing I kind of want to add here, this can be considered as a prototype. I would admit this is the first time our office trying to put something like this together. So probably it's not perfect, and we have to work with the data limitation that we have, but it's a good start. Now we have a prototype, and with the scaling of virtual visits, potentially in the future, we will come up with better model, more accurate and larger data set. So we'll be able to demonstrate the impact on larger scale and to show the bigger story. Another thing I want to say is that we also want to be really evaluative in everything we do. And one of the lens we take is we take the health equity lens, because there are a lot of conception out there thinking like a virtual visit or anything technology related. They are for tech savvy young people. It might exclude senior citizens, or that's for people who live in urban area. They have technology, Wi-Fi connectivity and everything. The rural folks may not have the potential to participate. And I personally wonder how virtual visit can impact equitable access to healthcare. And it worries me if it adds to the digital divide. So that's why we use this dashboard and we see things from the health equity lens. And we have some quite interesting finding. So a couple of things I think I can share is first thing I did is I tried to take look at things from the age perspective. So I see the number of visits per age group. So to be a little bit more accurate, I look at average visit per patient by age group. And surprisingly, we didn't really see any correlation between utilization and age group. And the number is pretty much similar. What's even more surprising is that the group with age over 60, they have slightly higher number than the age under 60. So it doesn't sound like they are being like excluded from the usage and application of technology. So that's really, really interesting to find out.
So what I'm hearing is that you're disproving the stereotype that elderly people don't want to use new technology, or especially like for something as complex as a virtual visit. Seems from your data they're equally comfortable as younger people are to adopt to this form of seeing their healthcare provider.
I would say, at least from this data set, yes, we do not see any pattern or correlation. Young people and senior people, they all participate and receive benefits from virtual health and virtual visits. One insight I kind of want to share is the project manager who actually helped to enable the services is that like virtual visit, it's not really about technology, it's more about the people. And when we have people who are willing to make things happen, things can happen. So I'm not going to like pretend that, okay, look at the number, everyone can use it, so those barriers don't exist, which is not true. We know that for some senior folks, yes, it's kind of hard to use technology. They don't know which button to push. They might not have a new device. And for people who live in rural areas, yes, we know connectivity can be an issue, but I feel like it's really important for health program to have the health equity mindset and try to make sure whatever service they provide, it's accessible to the target population they have. So in this case, we have the best team. They try to make the service really accessible, especially if their target population is basically seniors. They go above and beyond to make that happen. I can give you one example. Many people, they don't know that by default, you're kind of muted. You need to unmute yourself so the other people can hear you. So we sometimes make such mistakes, let alone those like senior folks who doesn't really do Zoom meetings all day. So we actually have some like some unit clerk, and they want to make sure like all the senior folks can participate. So they offer to do a dry run with those people before the actual patient visit. That adds to their workload, but they're willing to go above and beyond to make things happen. I would say this is partially the reason why we don't see like a difference in terms of utilization in this data set, because we had people behind the scene willing to go above and beyond to make things happen, to ensure things are equitable, at least within their power.
I really like the fact that you're not leaving this to an assumption. You're actually getting data around this to prove that whether access is equitable or not. And it's great that you bring up the point that it may look equitable right now, but that's because there's extra effort maybe being put in to ensure that these senior folks know how to unmute themselves and know how to use the technology, because they're doing, like you said, a precursor meeting to walk them through the technology. That's great. And it speaks to the people that you have on staff that are willing to do this and go above and beyond. Other than was there anything else that was surprising about some of the findings in the dashboard? Did you find any, because you were mapping this on a physical map, did you find any surprising pockets of people that you were serving that you didn't realize you were, or that coming from much farther away than you had realized before?
Julie, do you want to talk about your finding? I think you are the first one to notice that the distribution of benefits, and they mainly go to like rural and remote communities. And it's really interesting what we see on the map.
Yeah, we have people coming as far as Yukon territory. I mean, so that means, you know, they would be able to save a lot of travel costs and long distance if they were to actually physically visit their health facility. So yeah, basically across the province, the rural remote patients benefit the most. We found that I think a lot of cost savings definitely come from these patients.
Mm-hmm.
I can't imagine how far someone from the Yukon would have to come to to get their care. I mean, that might involve a plane or a very, very long car ride at the very least.
Yeah, that goes to like the population we serve, because PHSA has many unique programs and sometimes are very specialized. So it might not be possible for all patients to find the same type of service in their local community. And another thing I kind of want to say that today's world is not like what it is in the last century. People move around. It's not like people start something in one province, in one city, and they will stay in that city forever. And many program we work with, they do provide the longitudinal support. So they might follow up with the same patient after years of some sort of like encounter before. And they will be all around the province, all around Canada, even all around the world. So the virtual visit intervention does make it possible for this kind of intervention and longitudinal follow-up to happen.
What's the future of the dashboard? Is there anything that you're working on to enhance it or to improve upon it, or to maybe even to roll this out to old brand new programs beyond the virtual visit one?
Yeah, that's a good question. I think we kind of touched upon this a little bit previously. Like we can use this as a prototype. It's our first attempt to putting something together. And I think in the future, this can serve as an example, a tool. It will continue to be utilized as an analytical and a motivational tool. And when we get like a bigger data set, we can feed that into this, and we will be able to see bigger picture. And in terms of future, I think I would kind of mention we're all very analytical and evaluative in here. So we can try to like incorporate that into future projects and see if there's possibility to actually obtain the data that's required. The reason why we try this for the first time is because this is the first time we were able to like pull out the postcode prefix quite easily, so we can do the mapping. And previously we don't really have the capability to do it because the data is not easily accessible. So I would say this is like an early success. It help us to like do the evaluation planning for future projects. So this is what I see from my angle. Like, Julie, you want to add anything?
Sure, yeah, I think with all the virtual health solutions out there, I think one of the benefits of learning from this is that I will make that a requirement. Like if we're able to capture the prefix postal code of a patient, then you know, more accurate data going into the dashboard, then more accurately we can reflect the cost savings, the travel distance, and all that. So yeah, I think that's one thing I would like to work on, and also make this more publicly seen. So right now, yes, we are seeing it as a project team and within the organization, but I think it is also beneficial for patients to see that. So hoping that perhaps this interactive dashboard could be published on our external website too.
Yeah, another thing I kind of want to mention is that I want to encourage like digital health practitioners in the field to try to leverage that data set and do things like that. And maybe working together through collaboration, we can together fine tune our formula and to land on something that's more accurate and more like transferable. So for new project teams starting to do something like that, they don't have to start from scratch and trying to come up with a formula that's kind of reliable.
Go ahead, Chris.
Hi, I wanted to add too, Julie and Yang, do we know if there is a similar dashboard either in BC or across Canada? Because something I like to think that we're kind of forging a new path this way, but I certainly don't want to make any false claims.
I haven't seen any, but I understand that Vancouver Coastal has worked on a evaluation of their virtual visit projects, and they work together with the energy and environmental sustainability team to calculate like carbon dioxide or greenhouse gas emission. So
Surprisingly, there is potentially a climate impact just given the number of visits that might be deferred or not have to take any transportation to get to. It's not insignificant when you're talking about the province the size of BC, right? And the distances that some people have to travel. That's very interesting. I have to ask, because we're an IT publication, the tooling underneath it, the mapping and all this stuff, did you build this? Did you use a tool off the shelf? How was the technology underpinning? What is that?
I can go first. So I would say most of the case, like we are using the built-in capability of Power BI,
Okay.
a pretty standard mapping tool within it. We just need to like make sure we have the data set and we clean up our data set, make sure our data set is validated, and we feed the formula, like the calculation formula into it. Yeah, that's basically what we did. And we had help from our IMED's partners, so our like technical partners, to make sure we put in the formula right. But that's what I see from my perspective. Not overly daunting in terms of the technical capability, I would say.
If another authority around the country or anywhere else in the world, frankly, is anyone else in the world is looking to do a project like this, what would you advise them on? What would you tell them not to do or to do as they maybe start around the journey that you've already been on?
I think I kind of touch upon this a little bit. I do encourage people in the field to leverage the data to do things like this. Maybe discover some insights, maybe to prove or disprove a hypothesis, maybe just to put out something that's visually engaging for stakeholder. My advice would be like try to collaborate with people who has a bit more experience in that space, so you don't have to do everything alone and you can leverage the work that has been done, maybe a pretty good formula or something like that. Like our leadership always has a saying, like if you want to go fast, go alone. If you want to go far, go together.
That is a fantastic saying. I love that. Julie, any advice from you if someone else was thinking about this project or similar type of project? Anything that you would tell them to watch out for or do differently?
I would say definitely agree with being collaborate, because you won't know until you start talking to perhaps other provinces across Canada, what they're working on, other health authorities around you. There's so many technically savvy people and analytical teams like data scientists out there who can perhaps help you build a more sophisticated model to calculate whatever you want, and yeah, basically make it more robust and a way of seeing virtual health and how it benefits patients and families.
And Chris, what about you? I mean, as a sort of a person involved in the project, what have you seen and what advice would you give to someone who's thinking about going down this road?
Well, I can't take any credit for being involved in the project, to be honest. That's definitely with Ying and Julie. But so for Alex and I, as the communicators, we just help tell the story. But I would definitely say, just even to backtrack a little, provide a little context, to speak to how valuable it is for this information and just for the adoption of virtual health. British Columbia has a population of about 5 million people and an area of about 1 million square miles. So just to give a bit of a visual, like the United Kingdom could fit into British Columbia. So the adoption of virtual health at this time, especially during a pandemic, has been really huge. Really rapid adoption. We went from, I think, and Julie or Ying, correct me if I'm off on any of these numbers, but we went from, I think, roughly 1,300 virtual health visits a month to over 20,000 by the end of December. If I think that's right.
It's
We're
per
now
week, actually.
it was okay then per week.
Wow. Okay.
Yeah, it's really incredible. So having this is hugely important, and yeah, just having the ability to share the story about it is huge.
I mean, just the fact that you have this must be so validating in terms of the investment being made in this, both in time but also in resources. Right? We don't have infinite resources in healthcare, and so to be able to show that this technology and this approach to giving care is having such an impact in your immediate community must feel very validating, and it must feel very validating to tell this story to others.
Absolutely. It's very exciting. And thank you again.
Yeah,
For
no,
having
and
me.
this is great. And I wish my own province would do something like this, because I think it would score some points, let's just say, for the investments that the healthcare organizations around here have been making in this similar type of technology, but maybe haven't displayed it quite as effectively as you have. But no, thank you so much for all of your time to sit down with me today. I really enjoyed learning about the dashboard, and certainly wish you continued success with it. And I'd love to get together again as you maybe apply what you've learned here to other projects that maybe go beyond virtual care, because I think you're onto something to be able to validate and motivate people to adopt new technologies.
Thank
you
you.
so
I
much.
Thank you.
Thank you so much for joining me today. This has been Colin Hung with Healthcare IT Today. Have a great week.